During the first year, you can read a few topics
Gets
like
boring.
pharmacology. So to keep yourself interested, you need to watch the images. You need to picturize them. Second class students, getting students will write whatever they know, but first class and distinction getting students will write what they. So, for example, if you are writing about a drug, while reading only, you have to memorize the
Hello,
drug.
this is Dr. Dheeraj Masapu. I'm a consultant anesthesiologist specialized in neuroanesthesiology. So today we have a very famous Dr. Karthik with us. You would have seen his anesthesia notes Instagram channel. A lot of memes he would be doing. I've been following those memes since last 6 months, Dr. Karthik, and they're really funny. Every meme I see and I laugh a lot. Welcome to the channel, Dr. Karthik.
Thank you. Thank you so much, sir, for the kind introduction. And also, I appreciate for your efforts taking out so much time in your busy schedule and making some videos which will be helpful for the future generation, sir. The career oriented videos, they are very good, sir. I have seen every video of yours. They are very insightful, sir. Thank you for those videos.
Thank you very much, Karthik. So basically, this video is more about our preparation strategies for MD anesthesia students. So now the counseling is over. A lot of students have actually taken up MD anesthesia diploma and NBMS diploma. Total 6,000 people joined anesthesia this year. So for 6,000 people and 3 batches, so some 18,000 people would be watching this video. So from first year, how should they prepare? Pass the exam and DNB exams.
Okay, sir. I'll try to keep it as candid as possible, sir, because I don't want the students to get bored listening to this video. So first of all, sir, the major problem is most of the colleges are studded with all kinds of surgeries and super specialties. And especially during the first year of PG, you will not get any time to study, sir. Even if you get some time, some leisure time, you will want to sleep or you want to watch Netflix and all, but you will not feel like studying, sir, because you'll already, get fed up doing all the cases in the morning. So first of all, the major problem is the time, sir. During the first year, especially, you'll not get time. So during the first 1 month, especially, it will take some time to acclimatize to the OT environment, whatever is going on, knowing about the sterile, unsterile things. So in the first month itself, getting acclimatized to the staff, friends, and your OT, OT people, these all will take at least 1 month of time. So leaving that 1 month, from the second month onwards, you have to start preparing. Uh, I mean, get oriented towards the education, get oriented towards learning the subject, because we all know that we'll have very least exposure during the MBBS or during your internship about the anesthesia. So make sure that every day you are going to study at least for 1 hour. During the first year, if you want to divide into year basis like first year, second year, and third year, during the first year, you can read a few topics like pharmacology, then the equipment and anesthesia machine, then basic physiology, and you'll have to read about the regional anesthesia part like the spinal, epidural, and caudal anesthesia. This will be sufficient during your first year. So when you are starting reading, giving your first reading only, you just divide, make a broad categorization or division of the topics. So I'm going to complete these topics during the first year, second year these topics, third year these topics. As I said, in the first year you are going to read about pharma, equipment, physiology, and regional anesthesia, few parts. Then coming to the second year, you have to go system wise during the second year. First year, the pharmacology and equipment part will take whole year first year because you'll have less time. But during second year, you have got juniors now and you will be posted in the specialties. So you can read about system wise anesthesia part. So you can go with CVS, respiratory, then CNS, GIT, liver. You can go for the ops and gynae, renal, ENT, then go for endocrine, then small subjects like opthal, ortho. So all is you have to cover during the second year. Also include the peripheral nerve blocks also. Okay, you have read about the regional part, neuraxial part you have read in the first year. You are going to cover the peripheral nerve blocks during the second year. Then moving on to the third year, you have covered 80 to 85% chunk of the portion in the first 2 years. Third year, beginning 6 months only, you have to complete about pain, critical care. Then you have to look after some recent advances, and you also have to look at least give one reading of the miscellaneous topics like ethics, there is statistics, there is sterilization of the OT, there are occupational hazards. Then comes the more volatile things like the physics, scientists, all these things you have to give at least one reading during the first 6 months of the third year. If you divide and categorize the topics like year wise, you will have a broad map of what you are going to do, how you are going to complete your syllabus. You'll not have fear before the exams that, yeah, I should have started reading during from the first year itself. So you'll not be facing such problems. So categorization is the most important thing. And also, sir, I wish my college didn't do that, but if any college is conducting any internal assessment, then it will be very great, sir. Actually,
Got it.
for every 6 months, I feel every college should conduct their own internal assessment. Just it is not for the college sake, but it will definitely help the PG students to assess themselves, to give a small preparation. If they give some portion and syllabus for that particular internal assessment, they'll just go through all the topics at least once. This will finally help them in their final exam. So that is how they have to. The students have to divide, sir. And if you talk about the textbooks which the students have to refer, sir, it depends upon the student only, sir. Like there are different textbooks. There is Miller, there is Morgan and Michael, then there is Barash, and for equipment there is Dorsch and Dorsch, there is Baheti. So and for special anesthesia also there is Smith's, there is pediatric anesthesia, there is neuroanesthesia textbooks, Cottrell's textbook is there. Then there is Kaplan's cardiac anesthesia. So there are many books, many books. So whatever book you want to read, what I feel is at least try to complete one textbook during your post graduation. Just stick to one standard textbook. Sir, even in if we consider Miller's also, all the questions which will be given in the exam, you won't find in any one book, sir. Even in Miller's also, you might not find few recent advances and all. If you think about scientists, if you are talking about physics, some topics might not be covered even in the standards textbooks. So there is no such textbook that which is going to cover whole syllabi. So you have to, if you are selecting one textbook, just stick to that textbook. If you want to read Morgan, you can stick to Morgan and start reading A to Z in Morgan. So if you don't find a question in the book you are reading, you can ask your colleagues, you can ask your seniors who might have already read those topics. So you can find from them where they have read those topics, where they found that topic easy. Then just make a note of each answer where you are reading from. I'm not telling to make a note of the answer, but you'll find different resources for each topic. Not all topics are available in a single book, right? You'll find one answer easy in the journal or some research article or some PDF or PPT given by your senior or your colleague. So uh, actually there is a book, sir. There is a question bank which I made, which is freely available in the Telegram group of mine. Okay. So in that, what I did is I made from all the state universities, I have taken the questions collected from different students, and I have made a list of questions based on paper 1, paper 2, paper 3, paper 4. And in that papers also, I have divided them system wise, equipment wise, pharmacology wise, physiology wise. I have divided them. And I have given a column beside that. Why I'm telling you is I have given a column saying page number or reference. That column I wanted to be filled by the students, because each individual will read at their own pace from their own resource. So if they read, for example, they're reading a neuromuscular junction answer, and if they found that answer good in Barash, so if they note down Barash so and so page number, then during first reading only, if you are doing all this is going to be very, very helpful during the final exam revision, sir. Because what we read in the beginning of the first year, we'll definitely forget by the end of the final year, sir. But you have the reference where you have read it. I have seen many of my friends and even myself also, sir. We have read everything, but we don't know where we have read that from. So it's almost like we have not read it only.
Got it.
So in that case, this will definitely help, sir. You have to make a note of anything you are reading. Make a note where you have read. That is very important. I insist my juniors for doing this, sir. So this is very important. This will helpful in quick revision at the final exam, before exam. And also there are many ISA video lectures also available, sir. Nowadays they are giving so many lectures. The National ISA Group, Kerala State Chapter, There are many, almost every state is having a ISA YouTube channel now. The education before and now is completely different, sir, concerned with anesthesia. There are so many resources. There are so many beautiful resources. And for volatile topics, there are many videos in YouTube also, sir. Everybody should make use of them for your exam. Because watching a 1 hour video is like very much insightful than reading something for 4 to 5 hours, sir. 1 hour video, it will just give you so much information.
It will be saved
And
in the memory.
what I feel is, sir,
It will be saved in the memory better. The video will be saved.
yes, sir, definitely. The audiovisual memory is very much more than, and we all know that anesthesia is a very volatile, and it's actually the factual parts of it will be boring also, sir. The machinery part, whoever is not in, involved in physics or not interested, you'll find it like 1 2 lines. Then after it gets boring. So to keep yourself interested, you need to watch the images. You need to picturize them in your mind. You need to make a mind map. All these things will help in long-term memory of the topic which you have read, sir. And that is one more reason whenever I write an answer, or when students try to give an answer in the exam also, they have to make sure that there are pictorial representation is more than just mugging up the answer or putting some paragraphs in the answer, sir. Make some flowcharts wherever required. You have to make some diagrams. All this good handwriting does not matter, sir. It's just the understandable thing. What you are writing should be just understandable. It need not look good. It has to be understandable. That's all. And during the first year, sir, if we are talking about first year and second year, what I feel is to make yourself easy for the Viva part or the case presentations part, or even during the third and fourth paper of your theory examination, where most of the case presentations will be asked, like most of the case managements will be asked. This should get easy if you are studying in your PG. If you'll have an elective list of cases for tomorrow. So you have, for example, you have a hernia case, or you have a laparoscopic appendicectomy or cholecystectomy tomorrow. So first year and second year students especially, they have to go through the case. Most of the students don't do that. They just do the cases, get with the PSs, go home and relax. But it is not very tough, sir. If you take half an hour, 15 to 20 minutes of your time and go through even in your phone, if it's not a book also, laparoscopic cholecystectomy, anesthetic considerations, if you type like that and you go through a few library journals or research article, if you read at least one article also, it is going to give a lot of information about tomorrow's case. And also it will make you so confident during the case tomorrow, sir. So it is my advice to read about tomorrow's case. That is very, very important, sir. And also I want,
you can remember.
You'll remember better. Exactly, sir. And also I wish people have to keep a small notebook also, sir. Whenever they are reading, for example, as I said now, if there is a laparoscopic cholecystectomy tomorrow, so if you maintain a small notebook, that notebook should exclusively should be for writing the special considerations for the cases, sir. So if you are doing some 50 to 100 cases during your first year and you're writing the special consideration, if your induction with propofol is common for almost every case, so you need not write that. Write only the special considerations for thyroid case, hypo or hyperthyroid, what you're not supposed to do, what you're supposed to do, which drugs you have to give and which drugs you have to avoid, and any special thing in the PAC you have to ask, or any special thing in the OT preparation you have to get prepared with. So like this, if you write the special considerations and maintain a small notebook, and if before your exams, you can revise this small notebook anesthetic considerations, like hardly in 1 hour, you can revise about 100 cases, sir.
Oh.
That is possible. Your 365 days of hard work will help you before the exams. If you can study in 1 hour, sir. Like 100 cases, you can study in 1 hour. Rest of the thing will be same, sir. We all know. We'll start from glyco and end with glyco and neostigmine. That is common. So in between, whatever the patchwork is there, that if we highlight in the exam, that is more than enough, sir. So what people will do is they'll write whatever they know, but that is actually wrong. That's the major difference I feel it is present between a student getting a second class and a student getting a first class and distinction. This is the difference here. Second class students, getting students will write whatever they know, but first class and distinction getting students will write what the examiner expects them to know.
Okay.
So in that way, if you write what he might look for, what words he might search for in the answer, and you just put a small underline with the same blue ink, then that will give you a first class or distinction. So that is not a great deal. Both are same, but what we are writing and what you are highlighting is going to make the difference. And it's, if you talk, it is not difficult also, sir. It is easy. It is how we are utilizing the time during the 3 years of our post graduation that is more important, sir.
Got it. So next is about the anesthesia notes that you have written.
Yes,
And
sir.
so how did you actually develop this notes? How did it start, and like now how did it shape, and how much time did it take for you to write these notes?
Yeah, yes, sir. Actually, anesthesia notes, frankly speaking, honestly, I didn't know during that day that it would grow up so big, sir. So during my first year only, during my first year, I used to write the notes for the cases, sir, like what I have said before. So if there is a case tomorrow, I used to read about that case for 10 to 15 minutes, and I used to make some special considerations and all. I used to write down, sir, make a note of it. So initially, what used to happen is I used to note down and I used to throw away those pages somewhere. I used to write over the prescriptions of the hospitals. So it used to be missing. It used to miss somewhere, sir. So then what I decided was at that time I had an Instagram account. So I didn't want people to know that I'm writing these things, and I don't want to post it in my own account. So what I made, I put a name called Anesthesia Notes, and I started one page. And I didn't know that there was a private account, public account, and all. So it was, the account was public.
Okay.
Then I started writing these prescriptions, and in small white papers. I used to write the notes. I used to take a picture and I used to upload it so that it will be a reference for me. Even if I miss those papers, I can read it for wherever I am, whenever I want. I can, if I just log into Instagram, I can read those answers. Okay, I started writing them and uploading them for my sake initially. Then as I started putting as the notes grew up like 15 pages, 20 pages, slowly people started following the page, people started liking, people started commenting, people started messaging me that these notes are good, like that. So I have written so many notes I used to upload. Then slowly I understand, and what I understood was even the seniors in my college, my colleagues and my other friends from other where also, they also used to ask for the notes.
Yeah.
So initially, I used to write what I needed. Then gradually, people used to ask that they were finding some topics difficult, like vaporizers and all. So they wanted me to simplify those topics and write them in a simple manner that it is easily understandable, and also it is easily if it comes in the exam also, we can write it easily. So when people started liking the way I'm writing, people are understanding, because usually what when others make notes from some references, it is not understandable for everybody. But when I started making notes, people started appreciating, people started liking those notes, people started understanding, and the way we are approaching to a particular answer was completely different, sir. So it was completely handwritten. The major USP was handwritten. Then I used to simplify the topic as much as possible. I used to convert the answer into a flow chart. Then we used to make tables. Then the major thing is I used to refer to multiple standard textbooks for every topic, sir. I never used to like just put one answer from a textbook, just remove all the unwanted things and add those answers. It's not like that. I used to refer to a standard textbook. If it's a neuro question, I used to refer to a neuroanesthesia special textbook. Then some references, research articles, and also what are the recent advances going on in that confined topic. So in that way, I used to see in multiple directions, and I used to write an answer, and that answer also used to be only 3 to 4 sides, that hardly 2 to 3 pages only, so that it should be writable in the exam. People should not forget what they have read. So I used to make crisp notes. So in that way, it slowly grew up. It slowly grew up, and once there was a large compilation of the notes, people started asking me if I'm selling any notes. They wanted all the compilation of the notes at once. So I started my website called theanesthesianotes.com with the help of my brother and my uncle. They helped me a lot with the software. So I started the software. Then I started uploading all my notes over there, and I started selling it over the Instagram, sir. So this is how the journey of the anesthesia notes went.
Great. How do you manage so many things? One side you do Instagram, one side you practice anesthesia. We can make out by your Instagram side. You're saying your software, you're managing and all that. How do you get
Yes.
for all that?
Time, sir, basically, I omit other things, sir. I don't watch much of a web series or I don't watch much of Netflix. I don't watch TV at all, sir, basically.
Okay.
But I go out for games, I meet friends. Yeah. But the thing is, interest, sir. Interest is everything. From childhood only, I'm kind of a small creative kind of a person only, sir. So I used to have more interest in arts. Actually, any creative works, I used to have interest. Actually, if not anesthesia, I would have gone into fine arts or filmmaking, sir. I have more interest towards that. But somehow, I am the first doctor in my like family, complete the entire family. So I came towards this side. If not this, I would have gone towards filmmaking or any creative stuff, kind of fine arts, sir. So I always used to think about entrepreneurship, sir. I
Okay.
wanted to make something. I wanted to, you know, don't go in a conventional way, sir. Like what everybody is doing. If I'm working from 9 to 5 or somewhere, then I'll go talk in one or two hospitals. I'll do freelancing. Then I'll come home with all the stress built up. I'm not that kind of a person, sir. Basically,
Right.
I if there is no creating and productivity in my day, I will feel disappointed. Actually,
Okay.
yes, sir. So I felt this is creative. I felt this is my interest. And one more reason, major reason why I did not go for attempting DM is also, sir, I have done MBBS, then I have done MD. In MBBS, I have read a lot of subjects, and I feel I have not narrowed down myself by taking anesthesia. Everybody, sir, anybody who takes a specialization is they're going to narrow down their knowledge and narrow down their. That is how specialization will be done. And after doing anesthesia, I didn't want myself to still narrow down, sir. I wanted to be in general only. I wanted to get a exposure of everything what I am doing. I wanted to exploit complete anesthesia what I have already learned. In 3 years I have completed only studying anesthesia. I want to exploit complete anesthesia, sir. Whatever is there, whatever I have read, I have not used it till now. So I just wanted to see the depth, what it is already there. Then I'll go for other conventional ways, sir.
Got it. Got it. What are your future plans now? Like already your website looks like a startup. Actually, you're already an entrepreneur now with a startup kind of a model. So, any other plans you have for future? If you can reveal to the audience.
Future, basically, I'm kind of interested in content creation, sir, now.
Okay.
So my three agendas, sir, mainly. Whatever content I want to create, I want to give three things. One is education, sir. Education will be the major motto. For education reaching the people and them making it for them making it interesting, I would like to add entertainment, sir. So
Got it.
education with the help of entertainment, which will be a motivation for the people who want to reach there.
Got it.
So education, entertainment, and motivation, sir. These three are usually my agenda. So using these three, I want to create content and I want to stand out, being making students like they can believe that even if you go through to the unconventional methods also, you can still, there is a chance, there is a scope. After MBBS MD, you need not go through the conventional ways only to get successful, to be achievable. That is not the point, sir. So my future plans will be helping the students, getting anesthesia, making it simpler to them. I want to bridge the gap which the college between the college and students preparation there will be gaps, sir, actually, education wise. So I want to fill that gap. I want to make it more clear what has to read, what doesn't have to read, and I want to make more clear videos and get them a clear picture of the subject also, sir. That will be my more big motto for the future, like coming few years.
The anesthesia notes is going to come up as a video also maybe in future. Like foundation course you're already doing,
Yes,
I've
sir.
seen you in YouTube. So,
Yes, sir. I have started a few videos for the undergrad students, but as I get more experience and gain more knowledge, I want to reach the postgraduates also, sir, sooner or later.
Yeah, I hope you'll make another what is that edtech platform in future with anesthesia notes as the brand.
Yes, sir. Hope so, sir.
And
also, sir, I want to give a few tips for the exams also, sir.
Yeah, please.
Like writing the exam.
Yeah.
While writing the exam, one thing is very important, sir. One is understandable handwriting. The second thing is side heading, sir.
Okay.
So, for example, if you are writing about a drug, while reading only, you have to memorize the drug in such a way that you will memorize the drug in the exam in the same exact way. For example, if you are reading a drug, you are reading like you will first find the class of the drug, then the chemical structure, mechanism of action, pharmacokinetics, pharmacodynamics, dosage, clinical uses, and disadvantages. You have to read in this way. And during the exam also, for memorization, you have to memorize in this way. Whatever drug he might give, write these side headings, and you will definitely score a lot than others.
Good.
Not only for drugs, sir, even for case management also. Just 2 to 3 lines of a brief introduction about the case. For example, myasthenia gravis, you write 2 to 3 lines about the disease. Then go for directly preoperative assessment, then preoperative preparation, then intraoperative management. In the intraoperative, obviously, you'll write about the patient positioning, monitoring, then from intubation to extubation, everything, including the ventilatory parameters and analgesics. You'll write everything. And if you have any special considerations for that particular, if it is myasthenia gravis, are you giving succinylcholine? Are you giving vecuronium? So like that, if there are any special considerations, you are going to write. Or if the question mentions any special comorbidity, for example, a cataract surgery patient with diabetes mellitus and CVA or coronary artery disease. So regarding that comorbidity, you are going to add a few lines about that comorbidity. So you have to write special considerations. If you read in this order only, you will memorize in the exam easily, and also your representation of the answer is going to be very clear to the examiner. So this tip is very important for the exam, sir. And also for the previous year question papers, you have to read all the 10 years papers. If not possible, at least I wish the students should read the last 5 years question papers. You can get them in your library, or you can also consider the question bank which is there in the Telegram group of mine. It is very easy to cover all the previous year question papers, sir.
The link you give us, we'll put in the description.
Sure, sir, definitely.
So that will be to a Telegram group, and your anesthesia notes link already I'm putting in my description. So both of these, I think, resources will help a lot of students. So that they can,
yes, sir, sure.
Overall, you're telling to keep one base book and build around that. That is what
yes,
your suggestion.
Exactly, sir.
Can they keep your anesthesia notes as the base, or do you think this is like...
No, sir. This anesthesia notes has, I would say this anesthesia notes is going to be a very good supplement for your preparation, sir.
Okay,
but I don't say that it should be the only source. It is not the only source. It is not a standard textbook or anything. It will definitely be a good supplement for you to pass the exams and understand a few concepts, simplify a few concepts, and it will mainly tell you what not to write in the exam. Because if you read a textbook, you'll find a topic for 5 to 6 big pages, and if you want to write it down, it will go down to 10 to 15 pages in handwritten form, sir. So in my book, I'll tell what to omit and what to write in the exam, what lines to pick up. That is the main purpose of this book, sir. But it is just a supplement, sir. Should not be used as the only source.
So base book, I'll ask a straight question. Base book, which one do you suggest? Like one book only, without confusion?
Without confusion, sir, that's what, sir. It depends upon the perspective of the students, sir. If you are taking Miller's, there is a lot of research information in Miller's.
Yeah.
if you, but straightforward, my suggestion is go for Morgan and Michael, sir.
Okay, that's what.
Every first year who start reading, go with Morgan, sir. I would suggest Morgan.
So on top of that, they can build extra articles, research articles, meta, so many.
Definitely.
In Google now, with Google, actually type some PDF will come for every topic. Actually, there is a PDF now. At least in neuroanesthesia,
Yes, sir.
Anything you don't have to read a text.
It is there, sir.
It is there.
No need, sir. No need.
Yes.
But if you don't know anything about the answer, go for the article only, sir. That is the best thing. Go for a latest article. You'll have every information about it, rather than searching multiple books and finding one topic here, one paragraph here. That is getting haphazard is difficult, sir. Going for a latest research article is very beneficial.
That's what in DM preparation we don't read a book only. So the quarterly what you are telling, we just use it for the site headings of what topics are there in neuroanesthesia. So each topic we type in Google and get all the articles and read them. So that is a read. So because books are outdated, what happens is in DM preparation, most of the questions will be on what is the latest research, what is the level of evidence, what is the class of evidence. That in that level they'll ask. So in textbook, actually,
true.
Textbook is written 5 years back, no? So it will be
exactly, sir. Yes, sir. Textbooks are updated every 5 to 6 years.
So definitely, the research articles are very important. You have old information, actually. Correct.
Yes, sir. True, sir.
Then Morgan, which I studied, and now actually recently I saw it's a lot of difference. I studied in 2009. The book was totally different. Now the book is very updated and it is looking very stylish. It is good actually now.
Yes. Why I suggested Morgan, one more reason is if a first year boy or girl is coming from MBBS without having any idea about anesthesia and they suddenly take Barash or Miller's, they'll get frightened, sir. Actually, looking at what is that, looking at the font only, they might get frightened, sir. Such a small font. You are not going to understand the English also, sir. Actually, Morgan English is much simpler than compared to Miller's. And also the research, everything, the topic is not straightforward, sir. So a person who is already well versed with anesthesia for at least 6 months might understand what Miller's is trying to say, but for having a simplified knowledge of anesthesia, I feel Morgan will be a good book to start with for any first year candidate, sir.
So slowly, I hope you'll make either a video library or some textbook you'll write, I think, in future. So, but
I'm definitely hoping to help more students.
More than textbook, I think there are enough textbooks in the circulation. Video library is need of the hour, I think so. Because anesthesia, so many textbooks are there. We told the famous ones, but there are some 100 more textbooks actually. If you go.
Of course, sir. There are many, sir. There are a lot of textbooks.
In neuroanesthesia only, there are some 30 to 50 textbooks in actually in one small area. Imagine like that if you take pediatrics, OBG, so many I think 200 textbooks would be there easily.
Yes, sir. Definitely.
So then, Karthik, any final conclusion, tips and tricks and points you would like to tell for MD anesthesia first year students to start with? They're going to start now. You already told the book. And then notes of...
Yes, sir. So that's what, sir. Start, have a mind map, divide all the course into all these topics which I have told at the beginning of the video. Make a first year, second year, third year wise, divide your topics, go according to the topics. Try to read every hour, like every day, at least 1 hour. And for the final year students, I want to give one advice that nowadays, what I have been observing, looking at all the question papers of this year also, there is no actual paper-wise distribution, sir. Usually for paper 1, 2, 3, and 4, it used to be the basic sciences used to be the first paper. Then second, third used to be kind of case management, and fourth paper used to be recent advances and miscellaneous topics. But now the trend has been changing since 2 to 3 years, sir. There is no particular syllabus or fixed paper distribution is not there, sir. There is no syllabus for each paper. So any question can be asked in any paper. The recent advances or any miscellaneous topic can be asked in the first paper, and the basic NMJ can be asked in the final fourth paper. So be ready, with all the papers before the first paper itself. Don't pile up your syllabus for the day before the exam. So be ready 1 week before the exams only. Be ready for any kind of question in any kind of question paper. That is the most important thing. And one more thing I want to tell the final year exam going students is that you have to start practicing writing, because it has been so many years that we sat for 2 to 3 hours in a particular chair, and we have written something continuously for 3 hours. You'll hardly have some 8 to 10 minutes for one answer. So you have to think, you have to analyze, and you have to memorize. You have to write it in a neat way. So I want all the final year students to start practice writing. That is very important, sir.
They have to write off in 7-8 minutes, no, each question. They should not. Recently,
Yes, sir.
one student actually, I think she told me that in half an hour, 5 more questions were there. The last half an hour was left.
Yes, sir. Definitely from starting line and the last line, even who has written cannot differentiate, sir, what he has written. There will be a huge difference. The last line won't be understandable also, actually. Handwriting completely degrades.
Okay. So thank you, Karthik. And thank you very much for coming into the channel. And I hope this video
Thank you
helps
so
a
much,
lot
sir.
of people, and you should make more courses, educational courses in future. And you didn't tell us where you work. We only see the videos of your colleagues and your professors in our Instagram. But where
Yes, sir.
where are you from? You never
Uh,
put that up actually in Instagram.
yes, sir. Actually, I have cleared my NEET PG in the first attempt, sir. After my internship immediate attempt, I got into a private college in Telangana, sir. So I completed, which had a very good caseload. I have completed my post graduation over there. Then I worked as a senior resident at government hospital in Sangareddy, sir. It is also a town in Telangana. Then now I am working at another government setup only at MCH, sir, a maternal and childhood hospital in Telangana only, sir. Currently working there, sir.
But your center is good.
As an assistant professor. Yes, sir. Very good. Very good. It has a very good caseload.
Yeah, even pediatric cases, I saw you anesthetizing in some of the Instagram.
Yes, sir. Yes, sir.
So thank you very much. I hope your anesthesia notes, the memes are very funny. The last question is, how do you get the creative ideas for all the memes? Everything is damn funny.
Yes, sir. That's what. Actually, more than telling it as funny, I feel it is relatable, sir. That is why it is funny.
Yeah, relatable.
It is not funny for everybody. It is funny for only a particular category of people because they are able to relate to it. So my major USP for memes is making relatable stuff, which is automatically funny, sir, because we watch it daily. They relate that, this happened to me also yesterday. So in that way, it is relatable and eventually it is funny, sir.
Got it. Even many people share your videos in WhatsApp and those things also.
Yes.
So thank you, Karthik. And
thank you, sir.
We'll end the video session, and we can do a Q&A session in future because a lot of questions will come up for you. And we can
sure.
Maybe 6 months later, you can come for one more interview in the channel with the Q&A.
Definitely, sir. My pleasure.
Thank you very much. Thank you.
Thank you, sir. Thank you.